day, everyone. So next is your Dracunculus medinensis. So Dracunculus medinensis, or little dragon from Medina, is also called the guinea worm. So your guinea worm disease is also known as, or also called as Dracunculiasis. So Dracunculus medinensis was described in Egypt as early as the 15th century BC, and possibly was the fiery serpent that was described in the Bible. So, um, from the book of Numbers, no, the Lord sent fiery serpents among the people, and they beat the people, so that many of people of the Israel died. So, ito yung fiery serpent na dinidescribe nila. Then the medical symbol was also inspired by Dracunculus medinensis. So the guinea worm disease is spread by drinking water containing your guinea worm larvae, and it's considered by by global health officials to be a neglected tropical disease. Us humans now we become infected with the guinea worms by drinking unfiltered water from ponds and other stagnant water containing the copepods. So the copepods, these are tiny water fleas or small crustaceans that are too small to be clearly seen without a magnifying glass. So the life cycle of the Dracunculus medinensis is following ingestion, no? The copepods die and release the larvae. Which then, yung larvae na yun, they penetrate the stomach of the host and the intestinal wall, and they enter your abdominal cavity and retroperitoneal space. Then, after maturation ng mga larvae into adults and copulation, the male worms die, and the females, no, yung mga females, sila na yung nagmamigrate to your subcutaneous tissues toward your skin surface. So, approximately isang taon after that infection, the female worm introduces a blister on the skin, which is generally on the distal lower extremity. Pagkatapos nun, they rupture. And then, when this lesion comes into contact with the water, kasi, yung patient, no, naghahanap sila ng tubig kasi para ma-relieve yung local discomfort. Yung female worm, lumalabas sila, then they release the larvae. Then yung lumalabas na larvae, yun naman yung ini-ingest ng copepod. So, dun sa copepod, after 2 weeks, they have developed into become infectious larvae. Then yung ingestion naman nun ng copepods, they close the cycle. So, here is the illustration. Yan. Okay, so where is guinea worm disease found? So, only 14 cases of guinea worm disease were reported in humans in 2021. These cases were reported in Chad, Ethiopia, South Sudan, and Mali. Animals infected with Dracunculus medinensis are mostly domesticated dogs, and they have been reported since 2012. So most animal infections have occurred in Chad, but some have been reported in Cameroon, Ethiopia, and Mali, and previously in Angola. So, in 2021, Chad reported 790 guinea worm infected dogs and 65 cats, and Ethiopia reported 2 infected dogs and 1 cat. Mali reported 16 infected dogs and 1 cat, and Cameroon reported 10 infected dogs in border villages that were probably infected in Chad. Right now, there is no drug to treat guinea worm disease and no vaccine to prevent it. But they pull out the worm using the matchstick method. So, ito yun. So, once part of the worm begins to come out, no? Pag makita na sila lumalabas, they are pulled out a few centimeters each day lang. No? Parang paikot nila ito sa stick and or sa piece of gauze, then ginabira nila. Yan. So that's the worm, that's your stick. That's a matchstick method, no? And they can only be pulled out a few centimeters each day. So thank you very much.